am honored to introduce you to one of the most important people in the lifestyle medicine community here in New York City, Dr. Michelle McMacken. Dr. McMacken is the Executive Director of Nutrition and Lifestyle Medicine at New York City Health and Hospitals, which is, as you know, the largest public healthcare system in the United States. A practicing internist at New York City Health and Hospitals Bellevue, she also directed Bellevue's adult weight management program. And in 2019, she founded the innovative Bellevue Lifestyle Medicine Program, which was the first of its kind in a safety net hospital. She now leads the expansion of this program to 6 new sites across New York City. Dr. McMacken is also an associate professor of medicine at NYU Grossman School of Medicine, and she is an award-winning teacher. Welcome back to Downstate, Dr. McMacken.
Good morning. Thank you, Dr. Helsner, for that warm introduction. And I have to say, some of us were joking while eating breakfast that this is the first time I have had perfectly ripe papaya for breakfast at a conference. It was so delicious. So, I mean, this is just amazing. So kudos to you and the whole team, planning team. All right, so it's really my honor to have the opportunity to share some remarks this morning. Diabetes is something that I'm extremely passionate about, and I want to tell you a little bit about how I got here. So I am a physician, and as a physician in my training, I know it's cliche to say this at this point, but I genuinely got almost no nutrition education. I got almost no lifestyle education. And that continued through my residency training in internal medicine, and it continued through the first 9 years of my practice as an attending physician. It was one fateful day in the summer of 2013 where I had a little bit of extra continuing education money, and I thought, how am I going to spend this money? At that time, I had been a primary care doctor for almost a decade, and I was honestly starting to get a little burned out. Because what I was doing over and over with every patient was literally countless prescriptions, of course, billions of forms, and I just didn't feel like I was helping my patients actually get better. And it was a frustrating feeling, and I thought, I have to do something to change this. Now, that might sound selfless, but actually, it was almost more selfish because what I wanted to look for was a lifestyle conference for myself. And so I Googled lifestyle in medicine, like for me to have a better lifestyle, because I was burnt out. And the first hit that came up was the American College of Lifestyle Medicine and their annual conference, which was being held that year in Washington, D.C. in the fall. And I thought, lifestyle medicine, what is that? I don't know what that is, but I have this money, and I need a better lifestyle. It can't hurt. Let me go. What I learned there at that conference was nothing short of transformative for my entire career, and probably for some of my patients as well. Because what I saw was actually there's a tremendous amount of science behind our eating patterns and how that influences our health. I know this is not shocking to people who did not go to medical school. But for those of us who did, it's shocking. Wow, there's so much science showing the benefits of how we eat. There's science around the benefits of sleep. There's science around the benefits of exercise. And to see that science was incredible. And I thought, how many missed opportunities have I had where I haven't been employing this in my practice? And also, how do I employ this in my practice? I remember going back to work that first Monday morning after the conference and thinking, well, I'm so inspired right now. I have all this information in my head about what I want to do, but I don't really know how to make it happen with my patients. And my 9 o'clock patient that Monday morning was a woman in her late 50s who had immigrated to the United States from Ghana a few years before, and she had a history of coronary artery disease. She'd had a heart attack in the past. She had hypertension. She had high cholesterol. She had type 2 diabetes. And I realized right in that moment, I have never asked you, what do you like to eat? I've never asked you, How do you move your body during the day? How do you sleep? And so I said, let me just start by asking those questions. And what unfolded from that day was an unbelievably amazing enhancement to my relationship with my patients. She opened up and we talked about, what are the cultural foods that she grew up eating and that she still enjoys. She talked to me about her sleep. She talked to me about all of these aspects of her life that I had no idea, and it brought us closer. And I thought, well, let me just keep doing this. I know it takes, I have to figure out how to do this efficiently, but this is really fun. And so over the years, I got better and better at it and more efficient and was able to actually work with patients in a way that helped them actually change and, really listening to what they were ready to work on and supporting them in what their goals were. And so along came, about a couple of years after that, what I call the first sentinel event in my career. And that was a patient who I was taking care of, who was 42 years old. He'd been living with type 2 diabetes for about 8 years at that time. His hemoglobin A1C was 12.7 on this particular visit. And for those of you who are not familiar with that number, that's an average of your blood sugar over the previous 3 months, and a number that is in the normal range would be less than 5.7. So his was 12.7, very, very high blood sugar. And he had seen other physicians in our practice, and everybody just kept writing, refusing insulin, refusing insulin, refusing insulin. And I talked to him and I said, well, what are you interested in working on? And did you know that actually, I know you're not big on medications, would you be interested in making some changes to the way you eat and exercise? And he was like, sure, definitely. What can I do? So we talked about moving towards a healthy plant-based eating pattern. We talked about exercise. He actually loved to bike, and he had a bike. And I did successfully start him on metformin, which was great. He was like, I'll take one pill if you allow me to not start on insulin and work on these lifestyle changes. I said, great. So he came back to me 4 months later with an A1C of 6.9. And I'll tell you, I didn't recommend this, but he actually threw his metformin out the window 2 months into that. And the look on his face when I told him, you have reduced your hemoglobin A1C by 6 points in 4 months, and how empowered he felt, and how empowered I felt. I actually feel chills just thinking about it now, remembering that day. And from that day forward, I thought, I can never not offer this to a patient. It's not that every patient is going to be ready to make changes, but every patient deserves the chance to have the support and to talk about it and to see what they are ready to do. So there was no turning back. And then a couple years after that, I had sentinel event number 2. Sentinel event number 2 was the case of a 54-year-old woman who had a new diagnosis of type 2 diabetes. And so that day in my office, I told her, her hemoglobin A1C was 15.2. Really extremely high. Amazingly, she actually didn't have a lot of symptoms, and she also was very motivated to change her lifestyle. And I thought, this is great. Let's talk about what we can do. So again, I talked about a healthy plant-based eating pattern. She had immigrated to the United States from Mexico a few years back, and I said, what are the foods that you already like to eat? And which are the ones that are based in healthy plant foods, and how can we start emphasizing those more? And we talked about it. I gave her a lot of support over the next few months, also started metformin. And in 6 months, she came back with an A1C of 5.8 from 15.2. Then she said, and we celebrated, and I thought, this really is amazing. And she said, now can I stop the metformin? I was like, I don't know, she had made a lot of lifestyle changes, and I thought, I'm not sure what's gonna happen, but you know what? You've demonstrated you're extremely motivated. You keep your follow-up appointments, we stay connected. Let's see what happens. We stopped the metformin that day. 16 months later, her A1C was 5.6. She put her diabetes in remission. At that time, the definition of remission was a little bit less lenient than it is now, which is 3 months. This is a long-term lifestyle change that she sustained and kept her diabetes in remission. And in that situation, what I learned is now, not only is it unethical for me not to bring this up. When I have a patient with a new diagnosis of diabetes, where there's a lot of potential to put the diabetes in remission, it's unethical for me not to offer that as an option. So I think that the science and the recommendations are starting to grow around recognition of remission. We're going to talk about that today, and that's really important. And something that Dr. Helsner said is also really important, which is that although I will admit I'm extremely partial to nutrition. Those of you who know me know I love talking about nutrition, but we do need to think about and act on all of the lifestyle pillars. Just like Dr. Helsner said, sometimes, as much as I want to talk about nutrition, the patient's sleeping only 2 hours a night. How are you going to be able to make healthier eating choices when you're so sleep deprived? How are you going to be able to exercise and have the energy when you're sleep deprived? So we want to work with where the patient's starting. The other thing is the other thing I've learned is the importance of working with a team. Now, I'm extremely fortunate to have had the opportunity to launch a lifestyle medicine program, the pilot program that was launched at Bellevue. There's one extremely brave individual here with me who helped start it, Chrisanne Polito-Muller. It really started as a group of really, really dedicated physicians who were interested in this approach, a registered dietitian, Lily Correa, and our health coach, Chrisanne Polito-Muller. And we were very brave, and we started a lifestyle program. We saw really wonderful results in our patients. And in 2022, as Dr. Helsner said, we had the opportunity to expand that program. And that expansion included not just moving out to 6 new sites across health and hospitals, but also expanding the team itself. And so that meant that we were able to hire more registered dietitians, more health coaches, more physicians. We started to be able to include nurse practitioners in our program, community health workers, psychologists, program coordinators, and a fitness instructor. And I feel so lucky to be in the position to be able to bring together a team like this to help patients. I want to take a moment to acknowledge those of you, my colleagues who are in this room from health and hospitals. Would you be willing to stand up? And I would like to applaud you for being part of this program. Don't be shy. So we have a program in every borough. In some boroughs, we have 2 programs, including right across the street at King's. We have a wonderful program, and we have folks here from the Gotham Vanderbilt Lifestyle Medicine program in Staten Island, and of course, Chrisanne and I from the Bellevue program. So with that, I just want to say, even if you don't have an all-star team like I have right now, you can do this in your practice by yourself. There's so much you can do, even if you don't have an all-star team. It's wonderful to just start asking the questions like I did. Find resources in the community. There's so many, and I know at this conference there's going to be a lot of interaction and review of the different resources that are available. And most importantly, as a practitioner, just making your patient aware of what's possible and validating that this is a wonderful approach is so important. That your word goes such a long way. So I'm going to leave you with a quote from one of our patients who recently graduated from our program. He said, "I'm the healthiest I've ever been. I've lost weight and gained muscle. My cardio has improved tremendously. My sciatica pain and my stress levels have reduced. My blood pressure, cholesterol, and triglyceride levels have all improved. I sleep better, and I wake up feeling more energized. My only regret is not doing this sooner." Thank you so much.